While I was in college, I made the decision to go to medical school and completed my medical school training at the University of Michigan in Ann Arbor, Michigan. While I was there, actually, that I met a couple of residents in ophthalmology, and they convinced me to do an elective rotation in ophthalmology or eye surgery. For me, it's hard to say exactly why I made that decision, but I think that it was really the view of the eye through the slit lamp and the indirect ophthalmoscope. That enlarged view in the eye was just spectacular to me, and it just grabbed my interest, and that's what I decided to do. My undergraduate education was at two places, the University of California, Davis, and at Brigham Young University in Provo, Utah. And during those years, I made the decision to go into medicine. I went from there to the University of Michigan for medical school, and then to Philadelphia to Wills Eye Hospital for residency training, and stayed at Wills to do a fellowship in cornea and external disease. At the completion of that training, I was asked to stay on and teach at Wills, and we did that for a couple of years. But ultimately, we knew we wanted to be in the Western United States because that's where all of our family lived. We moved to Washington in 1991, and for several years I was in group practice. But in 1999, I made the decision to separate from that practice situation and to go into practice alone so that I could do more refractive surgery. Laser vision correction, the developing field of refractive surgery, really fascinated me, and so I developed a practice that focused more on helping each patient be more free of visual devices like glasses or contact lenses. I have really enjoyed the practice that I have, and we've had the opportunity of helping thousands of patients see better. When people come to Bellevue LASIK Cornea, I think they almost immediately recognize that there's a difference here. We have an office that's fully equipped to provide the very best of care, and we've assembled a phenomenal staff, and you will notice that as you come in. I have people working with me that care about people, and they're very interested in meeting your needs with regard to your eyes. When it comes to refractive surgery and laser vision correction, we definitely have the very best technology available, with having access here in our office to the intralace femtosecond laser for all laser bladeless LASIK. We also have two excimer lasers, the industry-leading Vizix and Allegretto lasers. So we're certainly well equipped to take good care of your eyes if you want laser vision correction. In addition, here at Bellevue LASIK, we approach cataract surgery in a very different way. In the past and currently today, many ophthalmologists view cataract surgery as simply getting rid of a cloudy brown lens and putting in a new lens and then going back to wearing glasses. Here we look at the total picture and devise a plan for cataract surgery that has an excellent chance of making you much less dependent on glasses. You may not need them at all afterwards. In 2001, I opened Bellevue LASIK Cornea, and located it here in Bellevue. It was a nice central location and a great area where there are lots of people who are active and interested in options for being free of glasses and contact lenses. In addition to refractive surgery, we also provide comprehensive eye care. So we can provide eye examinations for the whole family. We can provide a prescription for glasses or contacts if that's what people choose. We see many people to diagnose and manage eye diseases. We also provide other types of eye surgery besides LASIK surgery. We do refractive cataract surgery, which is another opportunity to free people from dependence on glasses. And I do various types of corneal procedures as well. I remember one patient who was a Microsoft employee, and he'd always been dependent on glasses. He had LASIK done and ended up seeing 2015, and he decided that he wanted to change careers. He had always wanted to fly, and he ended up moving back to New Zealand and getting trained as a helicopter pilot. And now he is taking tourists on helicopter tours of New Zealand. And he wrote us about a year and a half after he left here, and just a letter of thanks, and was updating us on what he was doing. But LASIK is a just tremendously exciting thing, and for many people it truly is life-changing. I personally think that it is very normal to be apprehensive about having LASIK surgery. I can't tell you how many times I've heard people say that I'm very dependent on my eyes for what I do. And in reality, we all are. But I understand that feeling. I know when I had LASIK, I had done thousands of these already, and I was still apprehensive. But this much I can say is that LASIK now has a 15-plus year record of providing good vision. And the reality is that there are very few problems with LASIK, and most of those can be managed. And here at Bellevue LASIK, we are particularly committed to helping you be comfortable as you make the decision to proceed with laser vision correction, and help you be comfortable as you're going through the process. We have patients every week that, as they finish their surgery, turn to us and say, "That was so much easier than I thought it was going to be."